Hi everybody, and welcome to my lecture on basic physiotherapy techniques and how they can be applied in practice. My name's Hannah Olive-Lee. You might also know me as PhysioRVN. I've got a social media platform on Instagram and on Facebook, so if you're interested in physiotherapy, nursing and a little bit of horse management, pop on there. So I thought I'd just start by introducing myself and what my nursing career has been like. So I started off in a lovely little practice called Cuff Vets, which is in Abbeville Road in Clapham. I sent out 365 letters as a student to try and get a placement, and these guys were one of the only 2 replies that I had, so I was very, very lucky. I then went on to study at City and Islington College as one of their first vet nursing students through the door, which was really exciting. And then I moved on to Goddard Vet Group, where I worked in a few of their practices at one time, and got to get loads and loads of experience through them. And then finally where I am at Pennard Vets in Sevenoaks. And along the bottom, I just thought I'd put some of what my life's like. So on the bottom left, I've got the love of my life, which is my Welsh D mare called Mabel, my lovely husband, my 2 dogs, Molly and Pepper, and finally my little cherub, who is April. She's a Hackney pony. She's on the endangered list, so I'm pretty into them. So anyway, on with our lecture today. What I want you to come away knowing is what the basic techniques are and how to complete them, what type of patients will benefit from physiotherapy, and what awareness to have for a mobility limited patient. And finally, what techniques we can use in practice to make it a little bit easier for those who find it a little bit hard to get around. So first of all, let's start off with what is physiotherapy. So physiotherapy is the treatment of an illness or injury by using physical methods. So this can be by the patient moving themselves, this can be by you assisting the patient moving themselves, or it can be by the therapist treating the patient. Now, it's a really broad umbrella and can cover so many techniques. So it can cover things such as massage, exercise, stretching, various use of machines. So hopefully by the end of today you'll have a little bit more of an idea of what these are and how we're going to use them. This little dog in the picture is who I call Super Sam. Super Sam was one of my first physiotherapy patients. He had a clot in his cervical spine that led him to basically have a sort of stroke, and he landed up not being able to use any of his limbs on one side of his body, and we eventually got him back walking again. So he's always going to be one to stand out in my mind. So when you begin physiotherapy, there are a few aims to consider. The first thing is we want to prevent any further injury. We don't want to make anything worse. We want to restore the function. So as much as we can, we want to get that animal back using everything as they used to be. Reducing pain, because obviously if it hurts, the animal's not going to want to work for us. They're not going to want to move. Building muscle. So a lot of the time our injuries are causing animals not to use a limb or not to use something. So therefore they lose muscle. So what we want to do is build it back up so that the muscle is actually stronger and will help support the body. And finally, we don't want to do any harm. So anything that we're doing shouldn't be making anything any worse, which is really important. So I'm going to talk a lot about massage because as part of our CSL or NPL, massage is included in there. Now we want to know what it actually does. So massage effectively is you using your hands to encourage the body to have all of these benefits. So we've got increased blood flow. And so we're going to get all the blood flowing into those muscles. We've got increased lymphatic drainage. So we know that the lymphatic system is like another circulatory system that runs alongside the blood system. And what that helps do is drain away any inflammatory fluid. Endorphin release, so these are happy hormones. So they also help with relaxing your patient. Retention of range of motion, very, very important, keeping that function that we were talking about earlier. So that's making sure that the patient can still move their limb or whatever body part as much as they could before. A reduction of scar tissue. So scar tissue is a tissue that basically tries to fuse everything together and keep it really still. Now, what that can actually do is cause quite a bit of pain because it's pulling on other structures, so we don't want that. And reduction of edema. So edema is a build-up of fluid of some kind. So I'm going to go through some of the massage techniques that you guys have in your MPL or CSL. So they have all very fancy names, but don't worry, we're going to go through all of them. So we've got effleurage, petrissage, deportment, friction, trigger point, and passive range of motion. All these things right now are going to sound just like funky words, but by the end of the day, hopefully we'll know what they are. So effleurage, which I always think the fleur sounds like flow, so we've got long flowing strokes. So these are basically what we use to warm up the muscle. So these are essentially just really nice long stroking motions. So as you can see from the picture that I've attached, this is my dog Molly. I tend to use a cupping motion over the dog's back just because it's an easy way to get hold of both sets of lumbar muscles. But you're doing long sweeping strokes. So just think like you're really giving the dog a really, really good rub. And when you're doing limbs, we're going to do it, so it's always paw to heart. So we're going up the limb and just gently wrapping our hands around the limb as we're doing it. So normally you sort of do this for 30 to 45 seconds. This is just to get all that blood flow and the endorphin release started. So it's basically saying to the muscles, hey, I'm going to start working on you. You need to wake up a little bit. Then we've got our petrissage, which is a kneading motion. So this is just getting into those deeper structures a little bit. And what it's also encouraging is every muscle is enclosed in what we call the fascia. So this is like a bag that basically the muscle lives inside that has a bundle of nerves inside it as well. So we're stimulating that as well. So this is like literally you can even lift some of the subcutaneous skin like you would be giving an injection, and that's just to encourage that to move. You can also do a motion sort of like where you're rounding your thumbs. So my trainer calls it the pecking bird. So you're sweeping your thumb across and pinching it into your hand. Then we're going to go on to deportment. Now this is what I would call your typical sort of chopping motion. If you see in people when they have a massage, they have a sort of chopping motion. Now in our dogs and cats, that's a bit too much. So what we're trying to do is strike the body with vibration. So what it works best is if you sort of lie your hand flat on the part that you want to work and then lift your fingers up and down and strike the body with that. So basically it's just sending little bits of vibration through the body. We used to use we used to use coupage, which was a cupping motion onto the side of the chest. Now, this is actually now contraindicated because we've discovered that when your patient's standing up, if you're using coupage on their chest, you're encouraging that mucus to fall off and go further down, deeper into the chest. And we know that the cough receptors are up at the top near the bronchi. So actually, by causing the mucus to come off, it can cause more of an issue. So it's not as recommended anymore. And I actually got that from the physiotherapist at the Royal College. So yeah, so that's deportment. So little vibrations. Friction is what I would call your very, very soft work. So you're going in very, very gently with your hands, having how would I put it, listening fingers. So starting very soft and just finding any lumps and bumps. You want to feel any bony projections and just very small, very little rounded movements. So this is just going through the muscle and searching for anything that could be causing any pain. And as you can tell, Muz was absolutely over the moon at being a model. Trigger point therapy is very, very similar, except we're looking even closer and we're looking at something much, much softer, which is the fascia, which is the bag surrounding the muscle. Now, this has a lot of interesting science behind it, but basically a lot of therapists believe that in stimulating the fascia in the muscle, you can actually cause the muscle to contract and then relax as a result. So this is a little bit further on, but it's just knowing all your different techniques and what they're there for. Now, before I go on to these, actually, I'm just going to go back through all of our techniques, because what you would do is, if you're building a massage, you would do your effleurage to start off with, right where we were, and then you'd move on to your petrissage, back to your effleurage before you move into your next appointment, back again to your effleurage before you move on. So in between every single one, you're re-stimulating that muscle, relaxing any contractions within it by using your long sweeping strokes. Now I wanted to talk a little bit about exercise, because that comes up in your CSL and NPL as well. So it's knowing the difference between what do the different exercises mean. So passive means that the therapist moves the patient. Active means that the patient moves themselves. And active assisted means that the patient moves with help. So passive would be, for example, a range of motion exercise, which is where you take the limb and you just gently circle it through any range that the muscle can have. So, for example, a front limb, you'd be going out towards the dog's nose, straight down with the leg towards the floor, and then bending it all up as though the dog's going to step up the stairs again. So that would be a passive movement. An active movement would be, for example, getting the dog to walk upstairs as a practice, or getting them to do a sit-stand to strengthen their back end. An active assisted is when you've got your patients, and we've all had one, who's in practice, who isn't able to walk very well on their own. So we get the towel and we support them walking. So that would be an active assisted. Or, for example, Super Sam needed a bit of help. We were actually moving the leg for him every single time when he first was starting to learn to walk. So that sort of thing would be your active assisted. Now, patients that are best suited to physiotherapy. I believe they're all suited to physiotherapy, but that's because I absolutely love it. In particular, we're looking at our geriatric patients. We're looking at patients with muscular wastage, so those who are not using a limb or a body part for some particular reason. Patients with proprioceptive issues, so these are your patients with a neurological problem who aren't aware of where their feet are going. And patients who have undergone long surgeries. Because we know that if you've been in, for example, you've got your Labrador who's been in for a foreign body surgery, they might have eaten 2 or 3 tennis balls, they've probably been laid on that table for quite a while in a position that they wouldn't normally be in. So it's quite nice to give them a little massage afterwards. I think I'd want one if I'd been in for surgery too. So I wanted to talk about our golden oldies, because they are probably the patients we see the most who need a little bit of extra help. Now, for me, there's so many different ways to look at their care. So it's not just physiotherapy, but it's things we can do at home. It's things we can get the owner on board with. It's things that we can change in their diet. So I thought we'd just go through a few of those. So home adaptations. Now, my poor senior clients get absolutely sick to the back teeth of me asking them all these questions about their golden oldies. So I thought I'd just go through one at a time, just to talk about things that we can do. So we know as our pets get older, and as we have certain breeds of pets who are more predisposed to things such as elbow dysplasia and hip dysplasia. I'm mostly talking about our Labradors and our German Shepherds. And we've also got some who are a little bit prone to spinal disease, like our Dachshunds. It's important that we actually look at things in the home, because with arthritis and physical pain, there's actually a lot that we can do to prevent illness or injury in regards to that. And it starts early on. So basically, all of our patients are classed as senior once they're over 8 years old. This means that a lot of pets, especially cats, are classed as a senior longer than any other life stage. So we need to be able to give them a little bit of help and also reduce that wear and tear on their joints. So at home, how are we going to do that? So the big one with our dogs, not letting them jump in and out of the car. Because we know the force it takes to jump in and the force it takes to jump out, they're going right down on their elbows sometimes, and that can be really, really painful. Getting a ramp, which is a simple solution, and they fold up, they're quite nice, easy ones these days, can be a massive benefit. I would always suggest that people teach their dogs to walk on the ramp on the floor first before lifting it up, and then slowly onto a curb, for example, or a step, and just eking it up until it's at the boot of the car. Slippery floors in the house now. I have to confess I have wooden floors in my house, and I struggle very, very hard to keep my 2 Jack Russells on the carpets that I have laid out, which will stop them sliding all over the place and hurting themselves. But we have the slippery floors because they're easy to clean, and we like that. But like I say, as your pet gets older, they're going to struggle, and you will find they'll avoid surfaces that they don't feel they can walk on, especially dogs with fluffy feet or cats with fluffy feet really struggle. So giving them a carpet or a walkway can be really beneficial. It doesn't have to be a carpet. You can also use the little foam jigsaw puzzle pieces. They're really good for in practice, actually. And keeping a couple of carpets or something similar like that in practice for over our shiny floors can be really beneficial for our oldies. Raised food bowls. I love talking about raised food bowls. Good for dogs and cats, but basically they should be raised to the height of their shoulder, so they've not got to stretch down. Because you imagine if a dog's got arthritis in their spine and they're trying to bend all the way to the floor to get to their bowl, that's going to be quite painful for them. So just giving them a little raised food bowl can just really help. And it also stops them, like I say, doing that big stretch, which can be painful. Orthopedic bedding, just to support them a little bit more. Sometimes they find it hard to get up, so it's important to find a mattress that's quite firm. And finally, steps up to sleeping spots or sofas or wherever you like, if not a ramp. There's some brilliant ones on the market now, including, there's a little one called, it's especially called a Dachshund ramp or something like that, which is really good, and it's just to reduce big jumps. So you can do this with cats as well. Cats can, we know cats love being in cat trees, but sometimes as they get older, those big jumps up into the top where they feel safe is really hard. So making them a little jungle gym of steps up to that can be so much easier on their body. Diet. Diet is really, really important in our geriatrics and in reducing joint disease. So basically, we want nice slim gyms. If we have a overweight patient and they've been overweight for a long time, that's going to put a lot of pressure on their joints. It's going to cause them to have more or a higher likelihood of having joint disease. So they're going to be more uncomfortable. Also, once they have joint disease, being thinner and being lighter on their joints is going to be much more beneficial to their movement. But there's also things we need to consider in their diet anyway. Are they getting enough essential fatty acids, which help with an anti-inflammatory effect? They also help sort of grease up the joints, so make it a lot more easy for them to move around. Omega-6, unfortunately, increases the inflammatory effect, so we don't want to have too many of those. And having some sort of supplement in there. So glucosamine, chondroitin, and green lip mussel extract work together to basically heal the damaged cartilage within the joint. The green lip mussel extract is particularly good. It's basically the wave shape it makes helps fill in the spongy material of the cartilage, therefore protecting it. Okay. Exercise for our older patients. Now, I'm sort of more talking about dogs here than cats, because cats like to be on their own schedule and we don't walk them loads. But with dogs, it's better to do little and often. There's no point doing one 30-minute walk a day. The dog comes home, they've got really sore joints, and they're just laid down for the rest of the day. And then when they get up, because they've not been moving, they've not got that blood flow, they've not got anything working for them, so they're really, really stiff. So it's better to do 3 short 10-minute walks to keep all those joints moving and all those muscles engaged with blood than one 30-minute walk. Or even better, if you can keep them toddling around little and often throughout the day, it's perfect. Avoiding jumping and stairs, because obviously, like I said about jumping in and out of the car, that big force of jumping in and that big force of jumping out. We want to keep it low impact as well, so no running off after sticks or frisbees or toys in the park. We all know that elderly collie who absolutely loves his tennis ball, sees it and forgets that he's had arthritis for the last 7 months, and then that can cause him a much bigger injury. And hydrotherapy. Now, hydrotherapy is so good for our patients because the water buoyancy basically lifts their weight off of their joints and allows their joints to move freely without having body weight, as well as taking the impact of every paw that's put down, so they're not feeling the jar. I love a bit of hydro. So supplements and medication is another thing just to get owners thinking about. Have they spoken to a vet about some anti-inflammatory or pain relief? Have they thought about treatments for helping repair and restore the joint capsule? And I'm talking about supplements, or there are some other treatments as well, such as PRP, which is platelet-rich plasma, which is where we take blood from the patient, we filter it through and we inject their plasma back into the joint, and that can help provide a long-term pain relief. So things we can do at home. There's a lot of physiotherapy or things we can do at home and recommend for the patient that works really well. So I'm just going to go through and have a chat about a few of those. So thermotherapy, let's start with that. Thermotherapy revolves around hot or cold therapy. So we could call it heat therapy, we could call it cold therapy, doesn't matter either way. What does it do? So hot and cold do two very opposite things. Cold should only be used at an injury for the first 24 hours. So this is to reduce inflammation and to help prevent pain. And you can only use it for 10 minutes every 4 hours. So like I say, cold, first 24 hours. Heat therapy, anything after that. So this is for your chronic conditions or for things that need a little bit of love longer term. And I recommend this to my clients quite often, especially if we know that we've got a patient who, for example, has very sore hips. So I would say, let's apply a warm wheat bag or a warm hot water bottle for 10 minutes every 4 hours if you have that, if not, especially before walks. So what heat therapy does is it reduces pain, increases the blood flow, and it thins the joint fluid. So especially when you've got an older patient or a patient who's struggling to move, having that thinner joint fluid is so helpful because it just means that the range of movement is a lot smoother. They've not got to work as hard to move the joint through. So, and with both of these, you want to test them on your own skin beforehand. And I would always recommend wrapping them in a towel. So wrapping either in your cold stuff in a towel, wrapping your hot stuff in a towel, just to prevent any cold or hot burns. Laser therapy is another thing that we can talk to owners about. Now, a lot of practices now are using infrared lasers to treat things like osteoarthritis, skin conditions, swellings, things like that. Now, lasers, very, very interesting. And what it does is it works by exciting the mitochondria, which is the energy part of the cell, into repairing. So, and each manufacturer of a different laser will have a recommendation on how to do it. The most common recommendation at the moment is the 3-2-1 approach. So you use it for 3 weeks. You treat 3 times the first week, twice the second week, and once the third week. And then you assess the patient from there on. Now, it's really important with laser therapy. Safety is a concern because obviously these lasers are quite high powered and can damage our eyes and our patient's eyes. So always providing goggles for your patient and for yourself, and making anyone outside of the room aware that you're using it. Each manufacturer does a training course quite often on how to use it safely. So if you do have that in practice, make sure you get your training done. Stretching. Now, stretching is really, really underrated, but having a set of stretches given by your physiotherapist or given by your vet can be really beneficial. So stretching helps keep that range of motion. So it helps keep the joint moving in the same amount of motion that we had before. So we wanted to restore function or keep function. So stretching helps with that. The other thing that stretching helps promote is blood flow and collagen alignment. So collagen alignment is basically all the stretchy stuff in your cells to keep everything moving. And collagen is what scar tissue can be made up of if something isn't moving. So when we're stretching our limbs that have an injury in, it's really important that, one, we're gentle with it, but two, we persevere, because basically it will align this collagen and prevent scar tissue and also keep all those finer tissues moving, which is what we want. So what can limit a patient with reduced mobility? So I have a little bit of a thing in my life called Mobility Matters, and I absolutely walk around going, could my dog get up that? Would that dog suffer with that? Would they struggle here? So it's looking around your practice and going, okay, well, this floor's really slippery. So if I've got an elderly patient, I might use the consult room floor because it's slightly grippier, or I'm actually going to keep a little rubber mat handy so that if we have to take bloods in this room, it's not slippery for them. You have to look at things like, how is it to get from the consulting room to the hospital in your practice? Do you have to go upstairs? How many stairs? Could you put a ramp in instead? When I'm handling this patient, if they're sore or if they're arthritic or they struggle to move, what's going to be the best way to do that for them? And I'm thinking about the individual patient as well. So, for example, we know that this dog has bilateral elbow dysplasia. So we're going to put a catheter in his back leg instead of his front leg, because holding his elbows is going to be really uncomfortable for him. Or, maybe placing a catheter in with him in a laying position instead of a sitting position might help. So it's just having a little think about it before introducing the patient, especially if you know they're really creaky. What can you do to improve the mobility around the practice? So I want more and more people, it's my dream to have more and more people thinking, well, hang on a minute, don't bring that arthritic or that lame dog up the stairs. Why don't we go the long way and we'll go up a ramp instead? It might take a little bit longer, but ultimately that patient's not going to look up those stairs and think, oh, here I go, this is going to hurt. So, if they're already painful, we just want to keep an eye on how they're moving around the practice and how we can help them around the practice. Have a little chat with your colleagues, throw some ideas around about what works best, about what ideas you guys have, start some mobility and arthritis clinics. So, for example, talking about all those things that we've talked about with our geriatrics, so your home adaptions, your diet, are they on any pain relief? Have they started showing signs of arthritis? So, and what I mean by that is, does your pet think twice before they're going to jump up? Do they sort of look in the bowl and go, oh, do they seem a bit depressed? Is your cat not grooming itself like it used to? These can be early indicators that your patient just isn't comfortable. Does your dog go and bark at the door anymore when the postman's here? No, he doesn't, because it takes him so long to get up. Okay, did he used to come to the door all the time? Well, yeah, he did. So just having those conversations and actually starting a questionnaire. about your patients and your senior patients, going through and talking about them and seeing what things have improved and what haven't. Create discussions within the practice. Is there a better way that we could move our geriatric patients around? Is there a more comfortable way that we could lie our older patients in theatre so that they're not as stiff afterwards? And this TPLO dog that we know is coming in, he's quite a big boy. Could we get 2 orthopedic mattresses in to cover the whole of his kennel? Or could we use a rubber mat so it's easier for him to walk out to the garden? Those sorts of things. So don't be afraid to have these discussions. Finally, I thought I'd sort of talk about why I love physiotherapy and how I got into it. So I hope by now you can tell I'm very passionate about it. But I ended up getting into physiotherapy because my horse injured himself in an absolutely catastrophic way. He'd torn 2 ligaments and tendons in his back legs. And he was on box rest, so cage rest really, for quite a while. And I got into physiotherapy by rehabilitating him with some help from a physiotherapist. And I just found it so rewarding. And I thought, you know, we're looking at every aspect of this animal's care in a completely holistic way and asking ourselves, are they comfortable all the time? Which I just think is so important. So if you want to be an advocate for your patient's mobility, brilliant. Do it. Don't watch the cat struggle into a litter tray. Get them a flat one. You know, don't feel that you have to hold the dog that's sliding everywhere on the floor. Invest in a rubber mat so they can stand on it, or even pop a towel down. You know, it's just thinking that little bit further about making your patient's experience more comfortable. And if you have any questions or anything you want to ask me at all, please feel free. My inbox is always open. And you can find me on Facebook and Instagram at physio.rvn, or you can ping me an email, which is physio.rvn@gmail.com. And I hope you guys have enjoyed it. I know I have.